So, first of all, thank you for having me. And seeing all of you here, I can say one thing for sure: the future of ophthalmology is very secure. Great seeing all of you. I know it's morning and evening and everywhere. And what my take in any of these scenarios in life is, any difficult situation is a time to get polished and come out as a diamond. So that's my take on any scenario that goes bad as an external environment. I put together a video for you as I was instructed. And this video actually shows how the practice, my own practice, which is very unique, is how it was before COVID, what we're going through right now. And then we'll talk about how to revive the patient load. So here we are. So I'll show you here how patients every week in my office leave, doctors from all over the world, teaching all the time. My pleasure, absolutely a pleasure that I miss tremendously with surgeons, my own fashion things that I do in the evenings after surgery, patients coming from all over. I love them and the way I practice 1 hour at a time. Fun things they do with me right out of surgery, breaking glasses out of cataracts or laser techniques or fixing complications. Again, teaching part, whether it was at home or traveling. And then how my hugs became fist bumps and even more distance hugs before patients fly off. Then home with kids and family, watching movies, took off my suit completely, back to webinars, started cooking to show webinars and teaching premium cataract surgery with omelets, more webinars, did a masquerade worldwide challenge to increase the awareness and help globally by people making masks at home, more webinars. I actually found out gin tonic contains chloroquine. Then fashion, I kept on with it, never cheated, wore my trousers during the place and also reflected. Here's a snail I saw a few days ago coming out and then went back in, and like a turtle, we need to slowly, this was yesterday, come out back from this lockdown. And I'm sure we will all be back with a bang. So in lockdown, what I suggest in a recent interview I gave to Ophthalmology Times, I said, look in. You don't want to go back to something that was maybe wrong or misdirected for such a long time. So it's a great time to look in, get locked into your own self. Is this the practice you want it to be? Is this the dream you had as a doctor? We can always change things. And if you feel everything was in balance, congratulations. Great time to look at the transparency of your practice and how well you run it. Are you properly staffed? Are you struggling? All of these will show you the balance or imbalance in the way you practice. That's a great time to look in. Universal factors that affect patient revival. First of all, what patients will go through on the left side, you see orientation. Nobody knows what to do on the first day we're out, like that turtle, struggling to see where to go. And priorities. Is it priority about, do we still have a job security the patients are going to look for? The patients are going to look for what's our family doing, what happens at schools, colleges. So where's the priority for eye surgery? Necessity, again, what takes higher priority over necessity as an elective? Financial. Are financial secure people going to move into straight elective surgery? Will they take care of other things first? And all these are things that will go on in the patient's world. For us, a maze of new regulations, staff reorientation, new protocols to work with. We had some excellent lectures this morning about various things from sterilizations to taking patient calls, adaptation, maintaining all this. We still have to maintain our results and reputations would make people come. So we have a tremendous challenge here, but we have to still maintain what we are known for. Now, in my particular practice, very unique to me, practice-specific factors, because over 80% of my patients are referred from out of state, out of country. Mostly they come with their surgeons. So even the travel aspect, I have to study about what to do. Plus, on a personal note, I'm feeling obligated. I have about 7, 8 patients who stayed back in the US because I did fix their complications of the first eye. And then they thought this will go away in a week, so they stayed back in the US, and poor thing, they keep texting me every 2 weeks, doctor, what's next? So that's the personal practice-specific factors that I deal with. Scheduling. I'm not going to change any scheduling, so what my column is, I call stay, meaning I usually see one patient every 40 minutes, so there's no waiting in my office. It's one patient at a time, so nothing's changing. Mostly my practice is elective. Over 80%, as I said, travel. Visiting surgeons. Also, I feel obligated. A lot of them had planned their travels to come and see surgery. So none of those things I'm changing. What I'm going to change is, despite having one patient every hour and the way I practice, I will still have to put in extra COVID-specific protocols because distancing is already there. How do we operate? There was a great point about covering the microscope here. Sterilization during IOP measurements. How we navigate regulations. In my case in particular, how do I understand the inter-country travel now? What do we do with people who are traveling, and what do we do with people who are traveling from hotspots? How long do they wait? Do we defer or differentiate between them? How do we do pre and post-op? Most of my post-ops are next day, and then the surgeon, whoever has referred them from whichever country, takes over. And there's nothing much to do in post-op, but still, how do we correspond? Can that doctor see the patient? What's happening in their country? Have they opened their offices? So these are practice-specific factors that I'm facing. What have we been doing to maintain all this connection and revive the patient volume? Like I said, in my case, it's very personal, a lot of patients on text, but we basically stayed in touch with them. Newsletters, via social media, and it's amazing. This is a great time to see if you're really practicing the way you should, where your patients are all thanking you from social media. They're gratified with their vision. They understand your value. It's very important. Great time for transparency and internal to recheck. And then we have triage a number of patients through video conferencing, which is, in my case, again, I review the notes of their surgeons, look at the patient, discuss plan, topographies, all that, and they are ready. In the same context, we are planning to open this coming week in a very slow pattern, following all the rules, making sure maybe may not see any patient next week. We may start seeing patients later than that, but even other factors that I have to figure out. So action points as far as reviving is to stay in touch with your patients. Make sure your reputation and the work that you work so hard for doesn't go down because of higher regulations. You maintain that. So that is a factor to keep in mind. And of course, stay in touch with your staff, keep encouraging them that this is a mission, not just a job, and they realize that when they miss this. So those are my action points here. And once again, as I said, we do want to come back with a bang to the same fun we used to have with our patients and the privilege of being an eye surgeon. Way to be right there, Doctor. Lisa, amazing positive things to think. As I said, lock down, but lock in, find out what you are doing. Here's my most important parting statement, since I don't think we have more time I have to leave to. Don't forget who we are.
Yeah,
You're
absolutely.
one of the most brilliant people. That's why in college, among thousands, you became a doctor. Remember how your parents celebrated that. Among doctors, you were so brilliant, you became an eye surgeon. Stop looking at external forces to save you. Look inside, right here. You are the one who's going to save everybody. So please, look outside. Yes, follow those rules and all that stuff, but don't forget who you are, the most powerful person who can help others. That's my parting statement, guys. It's positive. Just be amazing, on track. You've got an amazing, privileged job to do here. It's amazing.